Hi everyone, this lesson is on constipation. So we're going to talk about an approach to the causes of constipation. We're also going to talk about some of the associated symptoms, and we're also going to talk about the ways that it is officially diagnosed and some of the treatments for it. So there are actually a few different definitions for constipation. One of them is a decreased frequency of bowel movements or an increased consistency of stool over a particular period of time. So less numbers of bowel movements than normal for the patient and an increased consistency of stool. We'll talk a bit more about this in a moment. Now, there's another definition where constipation is defined as a bowel frequency of less than 3 times per week. So having less than 3 bowel movements in a week would also be a definition of constipation as well. And then another definition would be looking at the Bristol stool chart, which we're going to look at here in a moment, and or a stool water content consisting of less than 50 milliliters of fluid. So in looking at the Bristol stool chart, there are actually 7 different types of stool. Type 4 would be considered normal, and less than type 4 would be considered a constipation type of stool. So in the third definition, we can look at these types of stool in the Bristol stool chart to make the definition of constipation. And this can also be applied to definition 1, where there's an increased consistency of stool, which would also apply to these 3 types within the Bristol stool chart. Now, constipation is a relatively common phenomenon, and it increases in prevalence with increasing age. So as a patient gets older, they're more likely to experience constipation. It's more common in Western countries, and it's less common in certain Asian countries. And it's important to make note of the fact that constipation is a symptom, not a disease. So constipation is going to be a symptom of some underlying cause or some condition that we're going to talk about in the next slide. Let's talk about the different causes of constipation and the approach to the cause. So by far, the most common cause of constipation is going to be idiopathic or functional constipation. This is where the actual cause is not known. And again, this is going to be the most common cause. Certain dietary choices can increase the likelihood of constipation as well. These are all going to include the following: low fiber intake, low water intake. So if the patient is not consuming enough water, they can be dehydrated. That's going to reduce the gastrointestinal motility. Certain milk products, so you can think of cheese, this can lead to constipation. And in some patients, alcohol can lead to constipation due to the fact that alcohol can dehydrate the patient. Certain medications can also cause constipation as well. These include opioids, certain antidepressants, iron supplements. So taking iron supplementation can increase the likelihood of constipation. And then multivitamins, because they contain iron as well. If there's an issue in the gastrointestinal tract itself, such as obstruction, this can also lead to constipation, because if you're obstructing the movement of gastrointestinal contents, that's going to reduce or stop bowel movements entirely. So certain obstructive causes like small and large bowel obstructions, a volvulus, which is a twisting of the large intestine, Ogilvie syndrome, which is pseudo-obstruction, and then gastrointestinal carcinomas like colorectal cancer, which is colon cancer. If there is a tumor that is blocking the large intestine, then stool will not be able to pass. So that can be an obstructive cause as well. Pain can also lead to constipation in some patients, abdominal pain conditions, so they may not want to use the washroom. They may try to avoid using the washroom. Hemorrhoidal disease because of the pain from the hemorrhoidal disease, and then anal fissures as well. So all of these can cause the patient more often to avoid using the washroom, which would lead to constipation. Some neurological conditions can also lead to constipation. We talked about Ogilvie syndrome before, but Parkinson's disease and multiple sclerosis can also lead to constipation as well. Endocrinological conditions can also cause constipation. These can include hypothyroidism, a low-functioning thyroid. This is going to lead to reduced gastrointestinal motility, so it's going to lead to constipation. Hypercalcemia, so a high level of calcium in the blood, can also lead to constipation. Hypokalemia, or a low level of potassium in the blood, can lead to constipation as well. And uremia, which we may see in chronic kidney disease. And then some psychological causes of constipation include depression. So depression can also cause a patient to have issues with constipation as well. Now let's talk about the associated clinical features of constipation. So it's important to note that a patient may be asymptomatic. So they simply are not having as many bowel movements as usual. So that would be the finding. So they may not have any symptoms at all, but they may have some associated symptoms. These include diarrhea. So paradoxically, we're talking about constipation here, but if they have a history of constipation and have history of diarrhea that alternates between diarrhea and constipation, this can be something to make note of because this can indicate the patient may have irritable bowel syndrome, which we didn't talk about before, but this can also be a cause of constipation in some patients. Abdominal bloating can also be a related finding with regards to constipation. There can be lower back pain, and then there can be straining and painful defecation. So if the stool is hard and lumpy, it may be difficult to actually pass that stool. Hematochezia can also be a finding. So hematochezia is bright red blood with the bowel movement. This may indicate hemorrhoidal disease as well. Tenesmus can also be a finding. So this is a recurrent feeling of needing to have a bowel movement. And feeling or sensation of incomplete evacuation can also be a finding as well. And then there's some red flags that should be taken note of if a patient does have constipation. These include nausea and vomiting. So if there is constipation and nausea and vomiting, this can indicate a small or large bowel obstruction. Abdominal pain can also be a red flag in some cases. This may be a symptom of gastrointestinal cancer, especially if the patient is older, if there has been changes in bowel movements or the shape of the stool, if it becomes pencil shaped, and there's abdominal pain and some other associated symptoms, this could indicate gastrointestinal cancer. Obstipation is also another red flag to look out for. This is constipation, but not only constipation, it's also not passing flatus as well. Delirium is also another thing to look out for, especially in older patients. And rectal bleeding can also be something to make note of. And then vital sign changes are going to be red flags as well. How is constipation officially diagnosed? So we talked about those definitions earlier, but there are some particular, more specific ways of diagnosing, and it's going to be by using the Rome 4 criteria and at least 2 of the following occurring over the past 6 months. So this is an official way of diagnosing constipation by Rome 4 criteria, but oftentimes a clinician is going to diagnose it clinically by using those definitions we talked about earlier. But we'll take a look at the Rome 4 criteria here. 1 is less than 3 bowel movements per week. We used that as a definition earlier in this lesson. 2 is straining that occurs more than 25% of bowel movements. So more than 1 in 4 bowel movements occurs with straining. Bristol stool chart of 1 to 3 occurs at least 25% of bowel movements. A sensation of blockage occurring at least 25% of bowel movements. A sensation of incomplete bowel movements or incomplete evacuation occurring at least 25% of bowel movements. And then in some cases, movement is required to complete bowel movement occurring at least 25% of bowel movements. So if there's at least 2 of these that occur over the past 6 months, that would be considered the Rome 4 criteria for diagnosis. And it's also important to ensure that the patient doesn't fit the Rome criteria for irritable bowel syndrome. So that's also important to make note of as well. Imaging can be used in some cases, especially if some of those red flags we talked about before are present. Endoscopy can also be utilized, especially again, if some of those red flags are present as well. And then how is constipation treated? So oftentimes it's going to be treating the underlying cause. We talked a lot about those causes before. Most of them are going to be idiopathic or dietary. So a lot of times we're going to focus on dietary changes as a potential way of helping constipation. So dietary changes, this means increasing fiber intake, increasing fluid intake, and avoiding some of those other constipation-inducing foods like cheese and avoiding things like alcohol. It's also important to increase activity and exercise. Increasing activity and exercise can increase gastrointestinal motility. So this is going to be important as well. And then laxative use can also be used if some of these lifestyle changes don't work. This includes bulk forming laxatives like psyllium. PEG or polyethylene glycol can also be used. Stimulant laxatives like senna laxatives can be used in some cases. Prokinetic agents can also be used. And then some emollient softeners can be used for prevention. So if a patient has recurring issues with constipation, emollient softeners can be utilized as well. And then lactitol can also be used in some cases, especially with chronic idiopathic constipation. And then in some more severe cases, if these don't work, an enema can be utilized or an manual disimpaction may also be undertaken. So these oftentimes can be performed in hospital. So that was a quick lesson on constipation. If you want to learn more about approach to causes of diarrhea, please check out my lessons on those topics. And if you haven't already, please like and subscribe for more lessons like this one. Thanks so much for watching, and hope to see you next time.